advanced therapies, and now radiotherapy. So everything is under one umbrella. For those of you that are clinical, you can understand what the benefits of these can be, right? Often in a clinic where you're dealing with imaging and radiotherapy, you're dealing with different vendors. It can be quite frustrating to be dealing with different contracts, different elements of the ecosystem. So to be able to talk to just one partner really it simplifies the process, right? It makes it very seamless from contracting to actually implementation and delivery of care. So what that gives us is we're able to cover the entire continuum of the patient's care, from screening all the way to survivorship. So Varian and Siemens together now. Before, Varian focused on treatment, Siemens was doing imaging and all these other things in between. So with the combination of the two companies, from screening all the way to survivorship. So you can imagine what that means in terms of having that data to know exactly what's happening with the patient from start to the end. And with that, therapy decisions are able to be made at consult, right? Treatment planning and delivery is able to be combined, and then survivorship is actually, it increases, right? So patients are, survival of cancer is actually on the increase now. And what that gives us is access to unprecedented data that was segmented in the past. So we do have that now, and it allows us to be quite aggressive in terms of what our ambitions are when it comes to the industry. We're looking to shorten the treatment time from diagnosis to treatment from 2 weeks on average. And this is the West, right? So when we're talking about 2 weeks to 2 hours, this is the West. In Africa, we know it takes much, much longer for patients to go from diagnosis to treatment. There are countries that have waiting times that are months, 2 months, 3 months from the time the patient is diagnosed. And that's because they don't have capacity. Some countries have only one linear accelerator to be able to treat patients. Some countries in Africa still have no linear accelerators. So patients have to travel to go overseas to seek treatment. But we have quite an ambitious plan with the combination of Varian and Siemens to shorten the treatment time from 2 weeks to treatment, 2 weeks to 2 hours from consult to treatment. And how can we achieve that, right? Being able to cover the entire continuum from screening again to survivorship, we have the data, we have the tools to be able to combine some of the processes. So consultation, therapy decisions can be made at consultation, and then we can do adaptive radiotherapy. So with adaptive radiotherapy, decisions are made on the machine where you can do sim and treat, basically. So this is how we can achieve that. And this is the goal of Varian with the combination of Siemens to shorten the time from diagnosis to treatment. Okay, so cancer burden in Africa. Sorry, my slide is actually a bit mixed up here with what you have. Can you go back? Okay, there you go. So what are we talking about? Cancer in Africa, right? Some or all of you may know how cancer is on the increase on the continent. I have some numbers to share with you in terms of what we are dealing with today. Population of 1.3 billion, almost about 10% of the population is diagnosed with cancer, right? About 1,109,000 cancer diagnoses a year. Close to about 70% of those of the patients that are diagnosed actually die from the disease. Close to 70%, right? So we have 711,000 deaths in 2020. If you put this in context, when we have outbreaks like Ebola, there are billions of dollars that are spent by the international community. But if you look like the latest outbreak that happened, I think about 7 years ago, less than 12,000 people died in over 2 years with billions of dollars that was spent. Cancer, we're losing 700,000 people, and we still have not prioritized spending in healthcare. I always feel like when we talk about healthcare, cancer is like the stepchild. Cancer is not talked about as much as it needs to be. But the numbers are there, right? And they are on the increase. So these are some of the numbers that you see. about 55 to 80% of cancer patients in low and middle income countries require radiotherapy. Only 10% of patients in low and middle income countries have access to radiotherapy. So this is why we are losing about 700,000 cancer patients every year. Today in Africa, we only have about 300 machines that are installed. We need today, as we speak, over 1,000 linear accelerators. So there's a huge gap that exists on the continent. Now, if you look at the mortality, the death in Africa, you look at malaria, TB, and HIV combined, the latest data, 1 million deaths, cancer 700,000 today. If things stay the way they are, by 2040, we will have 1.4 million cancer deaths versus only 300,000. So you can see it's swapping, right? The number of deaths by malaria and HIV is going down, while the number of deaths by cancer continues to go up. So what we do today will determine whether that number becomes a reality or not. So we have an obligation to ensure that we don't see 1.4 million Africans die of cancer by 2040 as projected. So by 2040, it's projected that we will have over 2 million cancer diagnoses a year. So there's a lot that we can do together to actually make sure that that doesn't become a reality. Also, if you look at, I talked about only 10% of cancer patients in low and middle income countries have access to radiotherapy. These are the numbers in some of the Western countries compared to some of the countries in Africa in terms of radiotherapy or LINAC availability. So the WHO actually recommends about 1 LINAC per 500,000 population. Ideally, you want 1 LINAC per 200,000, right? If you look at the United States, for example, you have 331 million population, and the radiotherapy units that are installed are 3,827. Okay? So you can see the disparity there. So it means in the US, for every 87,000 people, there's 1 linear accelerator. Switzerland, for 119,000 people, there's 1 linear accelerator. Now, if you go into the countries in Africa, for example, in Kenya, we only have 11 linear accelerators. So it means for about 5 million of the population, there is 1 linear accelerator. So remember, the recommendation is about 250,000 or 500,000. So you can see where that 1,000 gap exists. And the list goes on for most of the African countries. So that 1,000 gap spreads across for Africa, right? So we have quite a some work to do. So cancer in sub-Saharan Africa, the cancer mortality will go in sub-Saharan Africa right now at 520,000 to about 1 million by 2030. This is just sub-Saharan Africa that we're talking about, right? So what is responsible for that? National health insurance plans are inadequate. In fact, in Kenya, for example, the NHIF doesn't cover most cancer treatments. It's not adequate. It doesn't give enough reimbursement to cover the full cancer treatment that our patients often need. Awareness, we all know this. We see this around World Cancer Day. We're preaching about awareness, early detection, and all these things. But sometimes when you talk about awareness, we are focusing on the patients. In Africa, for example, the reason why the survival rate is very low is because patients present very late with the disease. Right? And is that their fault? Often it's not, because they may present early with some symptoms and they will go to their doctors, but the diagnosis is missed. Right? So education is not just for the public, it's also for the health practitioners, for them to make sure that when certain patients of certain age group present to them, that they are including cancer screening and making sure that they are checking, because we know that when the disease is detected early, that it's curable. So awareness is not just for the patient population or the civilian population, but it's also for the health practitioners as well. So even in situations where we have installed machines in countries around Africa, there's inadequate medical trained personnel. So you can have all the technology in the world today, but if you don't have the personnel, the trained personnel to actually use it for the benefit of the patient population, you can only do so much good. You'll end up with white elephants in facilities. So this is another reason why the problem exists. Long wait times from diagnosis to treatment. I've been to countries where you see patients waiting for 3-4 months to get treatment. And this only what cancer doesn't wait. So if you diagnose the patient and they have to wait for 3-4 months to get treatment, their condition is going to get worse. And there are situations where patients end up dying before they can even get treatment. So this is another reason why we have those situations. Again, like I mentioned earlier, cancer is under-prioritized. Most of the national spending that you see in healthcare, it's only a small percentage that is focused on cancer. Part of the reason for this is Africa is donor dependent, and most of the international partners are only spending on malaria, TB, and diseases like that. They are not focusing on non-communicable diseases like cancer. So as governments, you see that governments are struggling to actually take up projects where they are not getting donor funding. So that has to change. How do we close the care gap, right? So one of the ways is reimbursement. Government doesn't have to build cancer centers, but one way that they can encourage the private sector. So we were talking just now, the panels were discussing PPP, is to encourage private sector investment. One way to do that is reimbursement. If investors know that they can come into a country and build a radiotherapy center and there's a clear path to return on investment where they know if they treat 10 patients, 20 patients, they will be able to recoup through those reimbursements, then you'll see a lot of foreign or actually national investments into this space. So that's one way to do it. And also prioritization. I have to say in Kenya is doing better than most African countries in this particular area. The government has been quite aggressive in building local capacity. But the rest of the Kenya is not there. I'm saying they are better. They are not there. The rest of the continent actually needs to do some catching up. Localized solutions. When I say Africa for Africa, you cannot depend on having facilities that have to be manned or operated or actually, experts coming from overseas. We've seen this in Kenya. We've seen this in Ethiopia. We've seen this across the continent where we've helped or partnered to build cancer centers, and then there are no local trained staff. So this is something that requires a lot of collaboration, planning to ensure that we learn from what's happening today to train and build enough capacity within the continent so that you have people, Kenyans, that are actually, going to run these facilities, the doctors, the physicists, the radiation therapists, and all the staff that will be at these facilities. So we really need to focus our efforts to create local solutions that will be permanent, that are sustainable. Often you have centers that can afford to, they will bring experts from India and other places. It's quite expensive to do. It's not sustainable. And in those times, you may lose focus because at the end of the tenure of those experts that you bring, you may not have trained your local staff enough. So this requires a concerted, deliberate effort to ensure that you are building local capacity to make sure that your project is sustainable. And education and training, this is one of the biggest areas that needs focus. As a company, Varian, we don't just sell installed machines. We have education and training programs to ensure that we're training staff. But we cannot just train anyone from the street, right? You need people with the basic foundational knowledge to be able to, for us to train them. And this is product training. But we're working in some countries with national governments, bringing grants from the US to ensure that we're giving long-term training to try to close the human resource gap that exists in this area. Accountability also, right? It's and one thing that is quite encouraging is that when you go across Africa, you see or you hear from stakeholders in both the private and the public sector that they're tired of having white elephants. Often you'll see the big announcements, the shiny machine that is acquired,
and they'll just sit in a room somewhere, right? There'll be the pomp and the ceremonies, but after that, that's all. It's done. No one is paying attention to what that particular unit was brought for. So all the elements of what is supposed to make that project successful were not paid attention to. And you see all these shiny objects that are just taking up space and collecting dust. So I think now we're seeing outrage by government officials and hospital personnel that do not want these types of projects. And they are demanding accountability not only from themselves, but from the partners, from the manufacturers. As a manufacturing company, we insist on this, right? And in every project that we go into, there are elements that we ensure, because we don't want our names to be part of projects where they say the Varian machine at that particular facility is not doing what it was supposed to do. And that ties into what we have done in Africa as a company. Like I said earlier, we're a US-based company. We have moved into Africa aggressively, and we are going local. We're going local in every aspect. If you look at the map, the blue areas are where we have Varian linear accelerators, and the black areas are where there is no linear accelerator at all. It's not just Varian, but there is no linear accelerator. And you'll be happy to know that there is a Varian Kenya, right? So we're actually local in Kenya. Kenya, Algeria, South Africa. These are the countries in Africa where there is Varian local entity. In the coming years, we're looking to also set up office in Morocco and Egypt. In countries where we are not local, we work through distributors and we hold them accountable. We make sure that they are an extension of what we do. So in Kenya today, we have locally trained Kenyans that can install, service, and do everything that has to be done on our equipment. Education is a big part of that, right? So we want to be in Africa. We don't want to be sending our expats from the US or other parts of the world to come and work in Kenya. So we are leading by example when it comes to that. We have the know-how. We were founded in 1948 of how to do this. We've done it over an extended period of time. So we are committed to come into the continent of Africa and use Africans for Africa, right? So this is the goal, and that's the only way that we can build sustainable projects in the country, in the countries around Africa and the continent at large. In order for us to achieve our vision of creating a world without fear of cancer, we have to start from country to country, right? So that starts with having a Kenya without fear of cancer. How do you do that? You have to build capacity locally that will be able to support Kenya as a country. Same thing in Tanzania. Same thing in all the countries across Africa. So this is something that we're committed to do in the long run. The partnership with Siemens allows us to be able to do that more efficiently. Again, having the Siemens capabilities of imaging, diagnostics, and then combining that with the Varian capacity for treatment, it means that the future is really bright as far as what the possibilities are for cancer patients. We really are working on our end to ensure that 1.4 million projection for Africa, in terms of the deaths that are projected, that we can, perhaps make that number way less than 1.4. But we cannot do this on our own, right? I like the conversations that we've seen here today with panelists and from yesterday also about what governments, what private sectors are doing. So there's an obligation for all of us to do this, to be able to achieve the vision of Varian, which is to create a world without fear of cancer. Cancer doesn't need to be a deadly disease. It can be a manageable disease like what diabetes was some years ago. So that's really the goal. And we are local in Kenya. We are local across Africa. And, the word that I want to leave with you guys here today is that we should hold multinational corporations that want to do business in Africa, we should hold them accountable. We should demand local presence. And that's the only way that we can succeed and be able to build sustainable projects. So it's incumbent upon all of us to make sure that when we are having conversations about projects for Africa, that we demand that these projects can stand on their own. Thank you very much.
Thank you so much for those wise words and for your presentation.